All right, let's talk about something huge that's happening with the NREMT exam. If you're an AEMT or a paramedic in training, you absolutely need to hear this. A big change is coming, so let's get right into it. So, are you gearing up to take your AEMT or paramedic exam anytime soon? If the answer is yes, then you're going to want to lean in a little closer for this. Because, well, the test you've been prepping for, it's about to change in a pretty big way.
Yep, you heard that right. A brand new domain is being added. And this isn't about memorizing more facts. Nope, this is all about testing something deeper, something that goes way beyond what's in the textbook.
And here's the date you need to burn into your memory. July 1st, 2024. That's the go-live date. So if your test is scheduled for that day or any time after, everything we're about to cover applies directly to you. This is non-negotiable stuff to know.
All right, so let's get into the nitty-gritty. What is this major update all about?
Okay, there it is in black and white, straight from the National Registry. Starting July 1st, 2024, a new domain of clinical judgment will be assessed. So the key phrase here, the big kahuna, is clinical judgment. And listen, this isn't just them shuffling a few questions around. This is a real, fundamental shift in how they're going to evaluate you.
Which of course leads to the million-dollar question, right? What in the world is clinical judgment? I mean, we throw that term around all the time in EMS, but what does the National Registry actually mean by it? What are they looking for? Well, according to their official definition, it's the complete process of clinical reasoning and clinical decision-making. Think of it like this. It's not just one skill. It's the entire mental journey, from the moment you size up a scene to the second you make that life or death call for your patient. It's the whole shebang. And they break it down even further, which I think is super helpful. You've got two pieces to this puzzle. First, there's clinical reasoning. That's all the stuff happening between your ears, right? It's your brain sifting through clues, connecting the dots. It's the why behind your thoughts. Then you've got clinical decision-making. That's the output. It's the conclusion you land on, the actual choice you make. So one is the process, and the other is the result. And really, when you look at it, clinical judgment involves all this stuff. It's you being a detective, investigating, experimenting a little. You're synthesizing information, thinking critically, making those tough decisions, and ultimately solving a complex problem. See? They want to know that you're a thinking provider, not just a protocol-following robot. And this is interesting. They also tie it directly to leadership. And it makes perfect sense, doesn't it? Your ability to make sound clinical judgments is what makes you a good leader on a scene. It's about guiding the care, managing your team, and taking control of the situation for the good of the patient. Okay, so you're probably wondering, how on earth are they going to test something that sounds so abstract? Well, they've actually mapped it out. They're using a 6-step framework that basically follows the flow of how a clinician thinks. Let's walk through it. So here it is, the 6-step process. First, you recognize cues. What do you see, hear, smell? Then you analyze those cues. What do they mean? Step 3, you form a hypothesis. What do you think is going on? 4, you generate solutions. What can you do about it? 5, you take action. You actually do the thing. And 6, you evaluate. Did it work? This is the cycle that happens on every single call, whether you realize it or not. Let's make this more concrete. Take step 2, analyze cues. What does that look like on a test? Well, they might give you a bunch of patient findings and ask you to organize them or match them up with a likely clinical condition. It's basically asking you, can you connect these dots? Or how about step 5, take action? This is where the rubber meets the road. After everything you've assessed and figured out, the question will be, what's your next move? What therapy are you going to implement? It's all about choosing the right action based on the evidence in front of you. Okay, theory is great, but let's talk about what really matters. What is this going to look like when you're sitting in front of that computer on test day? Let's peel back the curtain on the new question types. To really test this stuff, they're introducing some new, more interactive question formats. So yeah, you'll still have your standard multiple choice questions, but you're also going to see things like graphical items, drag and drops, build a list type questions, and these new option boxes. It's going to be a bit more hands-on. First, let's look at the graphical type. This one's all about making sense of visual data, which, as you know, is a huge part of what we do every day. So what does that mean? It means they could show you anything from an ECG rhythm strip to a picture of a car crash, maybe a chart of vitals over time. And your job is to look at that graphic and answer a question about it. They're testing if you can spot the important stuff just by looking. Next up, we've got the interactive drag and drop. And this is where things get pretty cool. You're not just picking A, B, C, or D anymore. Now you're actively sorting and organizing information. So imagine you get a list of actions like IV access, oxygen, splinting. You'll literally have to drag and drop them into the right buckets. Which ones are immediate actions, which are secondary actions. This is a direct test of your ability to prioritize on the fly, which is, a massive part of the job. And finally, let's talk about the options box format. This is another new one that's designed to see how well you can classify information. Here's how it works. They'll give you a clinical condition, let's say a heart attack. Then they'll list some patient findings, like hypotension or clear lung sounds. You just have to check a box. Is this finding expected for this patient, or is it unexpected? It's a really clever way to see if you truly understand the pathophysiology. Okay, so listen up, because this is probably the most important point I'm going to make. This is not about new medicine. They are not adding a bunch of new diseases or drugs you have to memorize. The content you've been studying is still the content. What's changing is how they're testing you. It's a shift from what you know to how you think. So there you have it. The change is coming. But honestly, this isn't something to fear. It's a good thing. It's your chance to show that you're more than just a good test taker, that you are a good clinician. So the real question isn't about the exam. The real question is for you. Knowing this is coming, what are you going to do to start sharpening your own clinical judgment starting right now?